Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 6th video of rapid revision course of oral and maxillofacial surgery, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about flap types, and these are very important in perio as well as in oral and maxillofacial surgery. And in NLE exam in March attempt, triangular and trapezoidal flap MCQs was come. Now here in this table we will discuss there is a flap type: trapezoidal, triangular, envelope flap and semilunar. And in these there is first we will discuss about each flap sides, then blood supply, then reflection, then tension, then excess, then either it affect the gums or not, then modification, then possibility, then use, then advantages and disadvantages. Now first, sides. Sides, the trapezoidal are three-sided flap. One horizontal and in the clavicular region, gingival crevice region, and two are vertical. Mean trapezoidal are three-sided. Second is the triangular. Triangular is a two-sided. One horizontal incision in clavicular region, in gingival crevice, and one vertical incision. Third, the envelope flap have no vertical releasing incision. They have only horizontal gingival clavicular incision. There is a one-sided gingival flap because we give only one horizontal incision in gingiva over 4 or 5 teeth. If the ridge is edentulous, incision is made over the crest of the ridge. If ridge is edentulous, no gingiva, no teeth, then we make incision over the crest of the ridge. And this is over 4 or 5 teeth. Next, semilunar, it is a curved, look at below diagram, it is a curved like half moon. Below the vestibular fold, the lowest point of the incision must be at least, this is MCQ's point, 0.5 centimeter from the gingival margin, so that the blood supply is not compromised. And now come to the blood supply. The trapezoidal have limited blood supply, triangular have adequate, envelope have adequate, and semilunar have adequate. Next is the reflection. Reflection in trapezoidal easy, in triangular easy, in envelope difficult, in semilunar again easy. Next, tension in trapezoidal no tension, in triangular tension with tear possibility, in envelope flap tension with tear possibility, in semilunar again tension with tear possibility. Next, excess in trapezoidal is excellent, in triangular is good, but in other envelope and semilunar there is limited. Next, gums affected. In trapezoidal the gums is affected, yes. In triangular, yes. In envelope, yes. In semilunar, no, because they are 0.5 centimeter below from the gingiva. Next is the modification. We cannot do modification in trapezoidal, but yes, in triangular we can add another vertical releasing incision to change triangular into trapezoidal. In envelope, yes, we can modification, but in semilunar, no. Next, use. The trapezoidal are used in extensive surgical procedure, and envelope mostly in the palate to remove the impacted teeth, and semilunar indication, these are very important in the episectomies, removal of small cyst and root tips. Next is the advantages. In trapezoidal, no tension when flap is retracted, excellent access, allow surgery on more than one tooth. In triangular, adequate blood supply, good access, easily modified by adding a vertical incision or lengthening horizontal incision. Envelope, advantage is adequate blood supply, avoid vertical incision, easy reapproximation, easily modified. In semilunar, there is a small incision, easy to reflect, does not interfere with oral hygiene, does not affect the gingiva, no recession. Now, in disadvantages, the trapezoidal cause gingival recession, the triangular cause gingival recession, and limited access to lung root and tension during retraction. In envelope causes gingival recession, limited access, difficult reflection, great tension during retraction. In semilunar, there is a limited access, tension and tear can be mistakenly located over the bone defect due to miscalculation. Now, any flap that involves the gingival margin which will cause recession, vertical incision in any flap should never be placed in the center of the labial sulcus in the labial surface and should always extend into the interdental papilla. Now, the two additional flap types are, one is the elliptical incision, which are used for biopsies, which is two incisions that meet at acute angle. This is the elliptical incision. Next is the Y or double Y shape incision. These are used for removal of bony exostosis. Now you should remember semilunar incision indication: envelope, triangular, trapezoidal, elliptical incision, Y or double Y shape incision, and how many vertical sided and horizontal sided. This is all about flap and its type. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.